Yes, hi Evaristo. So sorry, uh, for some delays. Yes.
Yes, no
So,
problem.
yeah. So, the conference must be so busy, right, for you too?
Yes.
All right. So let's begin. So Evaristo. So welcome. So friends, have amongst us Evaristo Waya, from Angola, and he's right now at the 25th International AIDS Conference, the world's largest AIDS conference this year, AIDS 2024. Sorry, excuse me. And which is going on a very important theme of put people first, which indeed should be in the center of everything we do, not only in terms of responding to HIV, but also for sustainable development goals and for a better world order. So, welcome, Evaristo.
Thank you very much for the opportunity to share our experience in this 25th conference of HIV/AIDS on
Thank you,
behalf of
Evaristo. Welcome, welcome. So
humanity
let
to
me,
people.
yeah, before you begin, I think I should read out, you know, information that Evaristo has extensive experience as a frontline activity in Angola, in tuberculosis also, as well as he's contributed towards malaria and community health. His focus on meaningful HIV prevention and sexual and reproductive health discussions among adults and girls and young women needs a special mention. So thanks a lot, Evaristo, for doing such an important work in Angola. So over to you
Yes.
for your opening remarks.
Thank you very much. And as I said, it's a pleasure for us to share with you our approach on the community level as a Humana People to People Federation. I will start to say that as a Humana People to People Federation, we have started in 2000 our approach on TCE, which is a total control of the epidemic, with the logic that only people can deliberate themselves from the epidemic. It means that we have started very hell with the thinking that the fight on HIV/AIDS should be centered on people. And this conference that is taking place now is according, the theme is according to what humanity to people as a logic, put the people first. And I want to share that our contribution along this 24 year, it has been very, very impact on communities and also on people. And we always start with the people. And now we are on the progress that we have to contribute to the UN development goals, UN AIDS 99 percent. And then we see that some of our countries in the federation, they are very far to reach those goals. But we have countries like Angola, which is very far to reach those goals. But as a humanity to people, we have this common effort that we have to continue fighting. We have to continue to do this effort with people. And we are working with the HIV/AIDS. We are working with the TB. And as you know, TB is a critical disease when it comes to the HIV. And we are working with the adolescent girls and young women. We work with the pregnant women to offer the services so that they can keep in treatment those are positive, and also that we follow up with the exposed children. And we on our approach, we on the communities, the many players, the community health agent, because the community health agent, they are the link between the services and the communities and the people. And our objective is to bring services to the communities and also to bring people to the services. And this is a good alliance between the communities and also the health services. And what we do also exactly with the TB is that we are doing a community dot, and also we do testing, for example, for all who are TB patients. We do screening, and also who will get a results. They do HIV test, and then we follow up them on the treatment. And our experience along with this here is that with the community approach, with the community health agents, we do HIV testing and TB in the community, because in the context of most our human people to people country is that the distance are considerable, and also the dispersion of the people. So the community approach is very important. And from this conference, we want also that after the conference, the governments and also the funders, they can increase their investment on the community approach. So that there will be a combination on the health services and the community response.
Yeah, thank you so much, Evaristo, for giving us this overview. It's really important. We can never say enough about how the importance of community-based interventions and community-led interventions, the role of communities, and how they should be engaged. So, can you please tell us more about how Angola is leveraging upon this approach, and particularly in response to different diseases? Like this is really important, and it will be a great learning lesson for all of us. Thanks.
Angola is progressing, but we want to do more advocacy so that we have like the framework, the legal framework in place. Because now today you can see that, for example, the key population, it's very important that they're on the board on the fight on HIV/AIDS. But in countries like Angola, we have to have law that can not discriminate the criminalize the LGBTQ plus, for example. And also we have to advocate so that we increase, as I said, the funding for the community-led monitoring, which is very important for the people living with HIV. Also, they can be part of to monitor the services, and also together with the service, find ways to improve so that the response can get on the right way.
Oh yes, so true. Even the recent, the not recent, yesterday, the new or day before, the global report of the UNAIDS showed that this is the first time more new HIV infections are occurring outside of sub-Saharan and Eastern Africa. So, like other regions need to learn what good is happening in African continent, and there are so many important lessons to be learned. Do you have anything else to add, like what Angola has been doing differently? Like if there is anything, and especially what you saw at the conference, if there is anything which, but let's come to the conference later. First of all, anything else which you would like to add in connection with HIV or tuberculosis? So one thing, for example, is in TB, like, how do you find TB? Do you look for symptoms? How can you find them early? Because a lot of TB in people living with HIV is asymptomatic. It could be of lungs. It is still asymptomatic. Even in general population, it is asymptomatic in countries like India. And also, so we need to find them early before to stop the spread, but also to reduce human suffering. And also extrapulmonary tuberculosis, TB of other parts of the body apart from lungs, is also very difficult to diagnose. But there might be some lessons there how Angola is doing differently under your leadership. Over to you.
That is a good question, because one of the issue when we're talking about tuberculosis is the earlier diagnosis, and the services of diagnosis in Angola, for example, are very weak. They are not accessible to all population. So now the government, what is doing differently is that is also allow the community health agent to do the diagnosis in the community, and also the professional health worker together with the community health agent, they do outreach program to bring those inaccessible people to the service for diagnosis. And also what we do is also that we do also diagnose for suspect people. It means that those who have patients at home, also we do screening to their contacts. And because we have to increase the number of diagnosed people, and also have to increase the number of people in treatments. And by the end of the day, we have to increase the number who complete the treatments. And in this cascade, the combination of HIV service and the TB service are very important in terms of keep people on the treatments. And one of the things that which is good in Angola, for example, is that the HIV treatment is free, and also TB treatment is free. But what we look forward for this conference, for example, is to countries like Angola to promote more ITPT prevention for TB, because this is one of the weaknesses in Angola. And in our delegation from Angola, we have on higher level the state secretary for the ministry, who is also doing participating on different panel to advocate, to understand, so that when we come back home, together with the government and civil society, we promote that there is a protocol for TB, protocol for HIV according to the present context.
Yes, thank you, Evaristo. Very important points. A lot of lessons to learn also, Evaristo. So thanks a lot for sharing those insights. About Angola, you are right that, it's good that Angola has free services. But as per the WHO Global TB report of 2023, out of about 120,000, TB patients, only 66,000 were notified to the government. And so what I'm trying to say is Angola is could be with co-infections or with other issues which need care. Lot of scope to do for Angola. One thing which I would like to request and appeal is that Angola has one of the lowest use of molecular tests for upfront diagnostics. The World Health Organization says since 2018 to phase out microscopy, because microscopy misses out 40 to only diagnoses 40 to 50% of TB patients, and will not be able to diagnose the remaining half. So that is why WHO calls for 100% upfront use of molecular tests, so that we can diagnose all of them or most of them, when anyone walks in for a TB test. So 2% molecular test use is really low. In India also it is very low. It is about 21%. So it is really appalling that in 2024, our governments are not doing enough to find all infectious TB, put them on treatment and care, use the best of regimens. And of course, when it comes to people living with HIV, they are more at risk of TB, many times more at risk of TB. We need to do way more. And only 7% of TB patients knew their HIV status in Angola. So what are your insights? What more needs to be done at Angola, so that we can ensure that no person, suffers because of TB or HIV? No one needs to die of AIDS or TB in today's times. We have the tools, and people like you, Evaristo, have proven that community-led interventions can save lives. Actually, these are the only interventions which have saved lives and really made a huge difference in not only in Africa, but even in Asia. We see a lot of hope from community-led interventions, such as done by Humana in India, for example, or other community-led organizations in Thailand, for example, Nepal. I was listening today in the conference. So over to you for your insights.
Yes, this is a very, very important issue. And what I want to complement is that two things are very important for Angola at this moment is to strengthen the health services and also to invest in the community approach. For example, one of the biggest issues is the abandon. The number of patients who abandon treatment is very high. So we have to invest on active case funding for TB in the community. And then this means that the community health agents, they are very important to do this part of the active case funding. And also, that TB is also associated with the high stigma and discrimination. And this is also community work. It's very important. And also one of the issues that the Angola is a very rural country, and the health facilities are not accessible to all people, to everybody. People, they can walk, for example, around 50 kilometers to 40 kilometers, 30 kilometers to find health facilities. Once again, the community health agents, they have to be empowered to bring the services in the community. This is very important. Also to invest on ITPT. And as one of the problems associated with TB is that the patients, they don't have transport to go to the health facility to get the medication, and also the nutrition. And most of the patients with TB, they are poor. They don't have food. They don't have transport. And so they have these catastrophic issues related to TB. So there is a need to invest on on how to solve the catastrophic issues related to TB, which is a transport to their services, and also diagnose. For example, the people with TB, they need to also to do complementary exams or diagnosis, but these people, they don't have money, because some of those services for complementary diagnosis, they have to be paid. But these people, they don't have money, and we are bringing difference in this with TB dots, because the community health agents also, they help the people with TB to get the treatment, and also that they take treatment, because most of the people, they get, but they don't take the treatment because they say no, they don't have food at home, or but the strategy that we are putting in place is that we have like 2 peoples for each patient in house, or in family, or a neighbor, who every day can also remind the patient if he has taken the medicine, what time, and also so that they follow they follow the regular taking of medicine. But what you are saying is correct, that Angola has to give another picture on TB in this sense. And as I said, TB is a very critical disease for HIV in terms of co-infection. That's why on our cascade of intervention we have TB and HIV.
Yeah. Yes, yes. Thank you so much, Everest. I totally agree with you, of course. And very important learnings again. It's of course important to find TB among people living with HIV, but anyways, because no human being should be suffering from a disease which is preventable, and not just TB. Even HIV is so preventable if combination prevention options are available, accessible to each one of us, and of course, and if people living with HIV are ensuring that they are on treatment, virally suppressed, and undetectable equals untransmittable. So, and there is zero risk of any further transmission, and treatment works as prevention. So there's so much more we can do, really. And thanks a lot for making that huge difference in Angola. So please do type in your email address and WhatsApp in the chat. We will send you the links and stuff in the chat box. You can type it in. Any final remarks, any closing remarks before we wrap up the conversation?
Again, thank you for the opportunity, and we are very happy as a human people to be part in this conference and to share all our best practice that we are doing in our countries. Today, for example, we have on our pioneer hearing how Botswana is progressing, how Botswana has achieved above 95%, which is a very important inspiration for other countries and as Humana people to people. This is one of the benefits that we get from Humana people to people, how we share the good practices. And also when we come to this conference like this one, the international conference, we hear, we learn, and also we share what we do. And when we go home, we can also do better, or we can improve, or we can also together with people see how we can every day do better. And once again, the HIV/AIDS has to be centered in people. And our logic of TCE, that only people can liberate themselves from the epidemic, is showing every day that is a very important approach. Thank you.
Yes, yes, Evaristo, absolutely agree. And let us hope that your words really come true, and and not only in Angola but in many other countries, they can adapt and learn so much from what the insights which you have just shared. So thanks a lot, Evaristo. Please do type in your email if possible in the chat box, uh, and your WhatsApp, and I will do the needful. And and have a great conference, by the way. Thank you.
Thank you very much.
Thank you.